Hi, my name's Maria. I'm one of the co-founders of Thier, the AI-enabled mobile platform for the prevention of lifestyle disease. Our mission is to empower businesses and their employees and consumers with tools that help them to make smart decisions. Our vision in the short term is to leverage the predictive power of data, the support of community, and the early interventions of healthcare practitioners to help heads of wellness to anticipate and prevent the emergence of lifestyle diseases within the employee communities that they serve. Our vision in the medium term is to collaborate with companies that are experts in nutrigenomics, nutrigenetics, and the microbiome in order to enable Thier to offer to employees at a granular level insights into how food impacts their physiology, hence enable them to make better decisions about the foods they consume. Our long-term vision is to develop financial services products which we will offer to our users. This is in line with Thier's strapline, be healthier, be wealthier, use Thier. Thier was established to help heads of wellness, heads of HR, and heads of occupational health mandated to manage the health and well-being of the employees they serve with tools that help them to identify, track, monitor, and prevent the emergence of lifestyle diseases within the employee communities that they serve. Our target audience are heads of wellness, heads of occupational health, and heads of HR mandated to manage the health and well-being of employees incumbent in organisations that offer private healthcare to their employees operating within the manufacturing, healthcare, technology, financial services, energy, and transportation industry. We are currently living through the midst of an obesity epidemic, which is driving up the numbers of people developing type 2 diabetes. In the UK and the EU, 6 out of 10 adults are overweight or obese. In America, that figure is greater than 7 out of 10 adults. This public health crisis is disrupting mid-tier and large companies in a number of ways, 4 ways to be exact. One is a rise in employee absences as employees seek time out for treatment, hence a rise in health insurance claims, a rise in health insurance premiums, and a fall in employee productivity. The effects on companies has been quantified in the USA, and is costing companies between $3,000 and $15,000 per employee per annum, depending upon the industry sector. In the UK, it's costing companies approximately £1,000. However, the burden of this epidemic falls predominantly on the NHS. The King's Fund forecasts that obesity will cost the country £9.7 billion by 2050, and diabetes is costing the NHS £14 billion per annum. From the perspective of employees, they can find themselves in the unfortunate situation of spending a number of years managing the debilitating effects of chronic diseases like obesity and type 2 diabetes, or in worst case scenarios, they actually die. Thier is focused on disease prevention, not disease treatment. In terms of experience, I have worked in startups and interfaced with C-level executives in mid-tier and large enterprises. However, I don't have domain expertise in the healthcare space. Hence, we will be hiring a CSO to bring that domain expertise onto our team. In terms of traction, we've onboarded a number of NEDs with backgrounds in building digital health products, delivering legal and compliance to digital health startups, and in fundraising for startups. We've also built 2 versions of our MVP. We've conducted over 200 interviews with heads of wellness, Gen Z through to baby boomers and healthcare practitioners. We have also joined Microsoft for Startup Hubs, and we're in negotiation with a number of potential investors.